We usually associate massage therapy with force. We picture heavy lubricants and intense downward friction designed to crush knots and relieve localized muscle pain. Manual lymphatic drainage operates under a completely different set of physical laws. It requires a whisper-light touch. A therapist might use 2 or 3 drops of oil for an entire body section to prevent the hands from gliding, and the pressure is so slight that it shouldn't even cause the skin to turn red. We can see just how delicate this is on this pressure gauge. While traditional physical touch registers far higher, lymphatic drainage is strictly contained within a microscopic window of 30 to 40 millimeters of mercury. To the untrained eye, a touch this soft looks entirely ineffective, yet this precise mechanical action manages to manipulate the entire internal fluid network of the human body. In 1936, Dr. Emile Vater and his wife, Estrid, established the foundation for the practice in Paris. They designed it as a highly targeted clinical protocol. Their specific goal was to treat patients suffering from severely enlarged lymph nodes by physically coaxing the trapped fluid out. The Vaters intended MLD as a mechanical intervention to address specific physiological crises. The entire process relies on strict spatial sequencing. A therapist always treats the proximal areas, those closest to the core of the body, before working on the distal extremities further away. By clearing unaffected upper pipelines first, you create a biological vacuum that naturally draws stagnant fluid upward. But traditional deep pressure ruins this process. Because the network lies beneath the skin, heavy force collapses delicate vessels. The 30 to 40 millimeter threshold keeps channels open. The therapist strategically opens biological gates, allowing the body to drain itself through its own natural pressure gradients. To operate those biological gates, practitioners rely on 4 specific mechanical tools: the stationary circles, the pump technique, the scoop technique, and the rotary technique. These strokes share a biomechanical trait, stretching the skin in precise ovals, where downward pressure lasts much longer than the release. Fluid inertia resists movement, but repeating the stroke 5 to 7 times overcomes this, pulling heavy fluids into functional lymph collectors. The technique carefully synchronizes with the body's natural rhythms, utilizing precise repetitions to accelerate its inherent lymphatic contractions. Because this method successfully mobilizes trapped systemic fluids, it carries serious risks. Moving fluids means moving whatever is hiding inside them. If a patient has a malignant tumor or an acute bacterial infection, the therapy is strictly forbidden. The strokes can force dangerous toxins directly into the lymph channels before the body has a chance to destroy them via phagocytosis, actively accelerating the spread of the threat. There is also a severe cardiovascular risk. If a patient's heart is failing, aggressively shunting stagnant fluid from the limbs back into the core circulatory system can fatally overload it. Even the nervous system is affected. The rhythmic touch acts as a tonic on the vagus nerve, which in some cases can inadvertently trigger severe asthmatic bronchial episodes. These high-stakes contraindications demonstrate the immediate and systemic reach of the therapy's mechanical influence. To manage that physiological flush safely, the clinical environment is strictly controlled. The table firmness is calibrated, bright glare is eliminated, and the room temperature is precisely regulated to isolate and calm the nervous system. Patients are required to eat light and hydrate heavily before a session. A full stomach slows digestion, creating a bottleneck when the body starts releasing waste from the abdomen and surrounding organs. Following the treatment, the body enters an active toxic flushing state. For at least 24 hours, patients must avoid alcohol, caffeine, and hot baths, while their system clears the mobilized toxins. Manual lymphatic drainage shows us that systemic biological transformations don't always require immense pressure.